Good morning, my dear friends. It's my privilege to welcome you all to the 243rd weekly webinar organized by AABN. Your presence here today reflects your commitment to spending time meaningfully, even on a weekend, and we truly appreciate that dedication. As you know, AABN has been engaging audiences with lively and insightful sessions designed to help aspiring entrepreneurs refresh their perspectives on emerging trends, visualize new possibilities, identify resources to support their vision, and understand the logistics of starting and sustaining a business. Over the years, many of our alumni have enriched these sessions with their real life entrepreneurship stories, making this platform a vibrant hub of knowledge and inspiration. Today, we continue this tradition with a subject of immense relevance, one that touches not only industry but society at large, protecting people and planet, integrating occupational safety, health, hygiene, and environmental sustainability for a resilient future. Before we move forward, I would also like to take a moment to sincerely thank Mr. Suresh Mariasalam for his continued support and cooperation. His steadfast encouragement has been instrumental in sustaining and enriching these weekly sessions. It's now my honor to introduce our distinguished speaker, Dr. Nailesh Reddy. Dr. Nailesh is a highly accomplished medical professional recognized for his pioneering contributions in occupational health, sexual medicine, and palliative care. With a career spanning clinical practice, industry leadership, and organizational governance, he has become a trusted voice in advancing workplace health and holistic medical care. His leadership his leadership roles include head of medical services in occupational health at Thermalay Chemicals Limited and Chamundi Die Casting Private Limited, Ranipet, President Vellore Indian Medical Association IMA 2023-2024, National EC member and regional head, South Council for Sex Education and Parenthood International, CSEPI 2023-2025, Chairperson, First Aid Committee, Tamil Nadu State IMA 2023-2024, Member, Blood Donation Committee, Tamil Nadu State IMA 2024-2025, Central Council Member and Crisis Management Committee Member, Vellore IMA 2024-2025. His academic excellence includes his journey reflects a deep commitment to various continuous learning, MBBS from Sri Lakshmi Narayan Institute of Medical Sciences, Pondicherry, AFIH, SRM Medical College and Hospital, Chennai, FCSM, IMA, CGP, Chennai, FCCP, PCM, IMA, CGP, IMAM, Erode, PGDHA, Alagappa University, Karaikudi, DIH, Raja Mutya Medical College for and Hospital, Annamalai University, Chidambaram. Career highlights includes early career in NICU and emergency medicine across leading hospitals in Vellore, over a decade as Chief Medical Officer at Murugappa Morgan Thermal Ceramics Limited and Carborundum Universal Limited, Murugappa Group. Currently spearheading occupational health services across multiple conglomerates, ensuring workplace safety, compliance, and employee well-being. His contributions and impacts include life member of IMA, CSEPI, and IAOH, frequent lecturer and trainer on occupational health for industries and the National Safety Council Tamil Nadu chapter, consultant to leading companies including Thermalay Chemicals Limited, Ultramarine Pigments Limited, Maladi Drugs and Pharmaceutical Limited, Chamundi Die Casting Private Limited. He supports implementation of occupational health audits for British Safety Council, 5-star business excellence, and responsible care initiatives of Indian Chemical Council. Dr. Nailesh lives by the philosophy occupational health care is a marathon, not a sprint. His dedication by protecting people and their planet makes him the perfect voice to guide us today. Friends, please join me in extending a very warm welcome to Dr. Nailesh. Thank you, and over to you, Dr. Nailesh.
Thank you, sir. Thanks for such a brief introduction. And the latest crown added to my shoulder is like I have been nominated as Executive Committee member of Indian Association of Occupational Health of Tamil Nadu State. So that is the latest addition that I've been nominated. And I thank one and all, and particularly Suresh sir, for giving me this opportunity to speak in such a big forum so that my insights can be shared to an extent to others because most of industrial concerns right now focus more on safety, and I am little more thriving to put occupational health and hygiene along with environment in that perspective. So that is my key where I speak more about occupational health and environment. So I'll try to make it in a nutshell. But since I believe out of 100 people, 10 people will be like that, there is need of a basic to be refreshed. So certain basics also will be there in my slides. So people who know, please just omit it. My slides are visible, sir.
Can you make it full screen, doctor?
Now it is visible, sir.
Visible, but it's not the presentation mode, I guess.
Actually, it's not.
1 second. Is it now?
Yeah.
Yes, sir.
Yes.
Yes.
Yes. Yes. Make it full. Yeah. Right. Perfect.
Yes.
Perfect.
So what we are going to speak, as I already kept in the agenda, I'm just going to talk more about like people and the people of the planet. So what we are going to focus more on integration of the occupational safety, health, hygiene, environment for a resilient future. So resilience is more required as of now as we speak because the technologies are changing and we are also in a process of evolving and changing ourselves day to day. So basic strategic integration is what I think is the approach for the healthy worker, safe workplace, and sustainable operations. So organization that excels in this integration may have safety metrics and better business outcomes. So as I already given my agenda, today I'm going to talk about these 6 topics: hazard identification and risk assessment, industrial hygiene monitoring and control, PPE and respiratory protection. I'll be a little more talking on ergonomics and occupational health, environmental sustainability, and about the safety continuous improvements. And also, apart from this topic, I'm going to add few points about the new OSH code, Occupational Safety and Health Code, which has been launched, which is going to be getting implemented in industries across India for a small insights on what is previous rules and regulations and what is going to be the new one. Sorry being bad because I have some cold, so kindly excuse that. So the basic foundation of effective safety management is prior and hazard identification and risk assessment. Most of us are not doing risk assessment as our day-to-day routine, and that is what is being lagged as an part of effective safety management. These risk assessment starts from smaller things and even it goes up to a broader perspective. But what we don't see as a risk may end up being a bigger risk. That is what we are facing day-to-day trouble in our day-to-day work jobs. And also now involvement of AI and other technologies are on top of us so that we are missing out certain contents. As you all know, the hierarchy of hazards. Now, the last hazard, we all know physical, chemical, biological, ergonomic, but the psychosocial hazard is the latest hazard which is being bombarded into our workplace health systems because we are not sure about the psychosocial aspect of each and every individual because systems are same, but the people operating the system are different. That is what we are going to focus more on psychosocial aspect. So, workplace inspections like regular structured examination of the work areas, equipments and processes, job safety analysis, incident investigations, and worker consultation. As a last part, why I kept worker consultation is before the job, we need to discuss with the people for their knowledge and experience whether they have the basic outline or we need to incorporate them because mostly this job oriented people or the jobs they come, they are fixed to certain SOPs what they are being working on their system, but when they come into other system industrial place they don't know that outline, so it is always better you do a one-on-one worker consultation. Risk assessment fundamental. As I already told, effective risk assessment requires systemic evaluation of both likelihood and severity of the potential harm. So when you see the likelihood of a harm, then you will come to a outline what they are going to do, what all the additional measures, and what are all the things that we can do quantitatively or qualitatively for the prevention of the consequences scenarios. So, as you all know, risk control hierarchy first is elimination, substitution, engineering controls, administrative controls, and the last one is the PPE. PPE is always at the last sort. So, what is a dynamic risk assessment in practice? Traditional risk assessment are conducted periodically or when significant changes occur. But dynamic risk assessment enables a real-time evaluation because the condition of the job and the condition of the place both varies accordingly. When you do the risk assessment for that particular job, it is a non-routine. So the workers will be trained in a dynamic aspect when to act, when not to act. That is the key line difference. So digital tools and mobile applications now support the dynamic risk assessment by providing instant access to the reference materials. Also, we are having the photographic documentation and also escalation to the concern, immediate transmission of the messages. And what about industrial hygiene monitoring and control? See, all there are a lot of things that we need to talk about each and every topic, but I'm not going to talk detailed on those stuff. I'm just talking about what is the need of the hour that should be incorporated in the current scenario. So the current discipline encompasses exposure assessment, toxicology. Why I mean toxicology over here is most of us are exposed to certain chemicals or substances which may be potent harm to the individual because the physical and physiological process of each and every individual varies according to their age. So toxicology is the latest thing that we need to know about whether they have allergy, whether they have that any kind of problems that they inhale or whatever. So toxicology study also needs to be assessed. And ventilation engineering and epidemiology. Epidemiology is only based on the wherever the workplace is happening, the chronic diseases which is non-transmittable. We don't worry, but transmittable diseases we should be ensured about the epidemiology part. Modern industrial hygienes employ sophisticated instrumentation and analytical methods to quantify the exposures. And usually the companies will have regulatory frameworks which has minimum standards, which needs to be more emphasized. So key exposure, we talk about only four things. One is a personal sampling and the area monitoring, real-time detection and biological monitoring. As I already told, biological monitoring is more important because it changes from the person to person perspective. Biological specimens, most of the cases it is taken as urine samples and others. So it to ensure that the employee or the worker is like constantly monitored. So what are all the critical exposure categories? As I already told, chemical agents like solvents, metals, acids, bases, and reactive substances. And particulates, most of the current scenario we are facing is with the particulates because we are using PPEs, we are using dust mask, and nowadays after COVID, no, we started using this surgical masks also. But the mask should be specified for that particular area which is given by the SOP of the company where we are working because it is less than 0.05 micron, then it is what is the type of mask that they're using, if the particle silica particles or what we are inhaling. So it depends only on the suggestion of that industry, not your own mask or not your comfortable mask that you should wear. So always think more about when you are exposed to a particulate matters, please ensure that you follow that company's strictly norms, not your own sophisticated things, because most of the things are respirable and it causes allergic and asthmatic issues. And physical agents like noise, vibration, radiation that we all know, but the latest one is like ergonomic hazards also as well as thermal stress. And last sort is a biological hazard, as I told. In this particular place, what I mean to say is not biological hazards by only common cold or cross infections or something like that. It's the organic dust that has that infection particles that may be inhaled and start some other serious complications. So we all know our occupational exposure limits. We follow time weighted averages and short term exposure limits. We follow different criteria, ACGH or OSHAS, NEOSH. We follow based on the industrial category. But what is more important is we should always be in a level to frame our own our own data. For example, right now, Tamil Nadu, the dish is creating, they are doing research work on creating our own Indian data. I'm also part of the team. Like we will be able to give some inputs. Like we will have our own like guidelines in the near future. Similarly, I request each and every one of us who are in the industry, please create your own guideline based on the standard guideline. But make sure that those guideline values and your values not having much of a difference. Meager difference is somewhat acceptable.
Dr. Nilesh, one question here.
Yes,
Can I
sir.
ask? Yeah. For example, it is an oncology molecule. How I'll come to know? I am in phase 1 development area. I am working.
Yes.
Whatever the products it is coming,
Yes.
the reagents I am using, it is a oncology or not? How I'll come to know that?
No, basically you will have that material safety data sheet. Whichever chemical or whichever agent that you are working, basically. Pardon, sir, I didn't get you.
Yeah. Proceed. Please proceed.
Yeah, okay. So the MSDS data, it very clearly gives. Previously, MSDS data sheets were not very elaborative, but right now, after the input of this from the guideline perspective, the MSDS data very clearly has given what are all the type of the problems that you can have. Even it is mentioned nowadays that it may lead to cancer. So certain solvents or something, it is very clearly mentioned that it has an oncological properties also. So the MSDS data sheet is more important before you work on a chemical or before you are going to expose on the same, because accidental spillage may occur at any point of time, we don't know. But what is the first aid needs to be done is the question mark that we should be prepared about it. Most of the MSDS are now having this oncological data also.
No, what range you are the guidelines?
No, no, sir.
Guidelines
For
is taken?
ontological data, there is no guideline, sir. It's only exposure. For example, the amount of exposure for how long you are going to get exposed. For a fraction of time is not going to be a problem. Short-term exposure is not going to be a problem. But as of now, the oncological evidence for a data of exposure is not given. Only it is given to the ultraviolet and X-rays.
Which situation I have to use the isolators?
Maybe if it is for a more than 4 hours exposure, sir.
Okay. For example, if I am charging the oncology molecule, the powder in 1 hour, so according to you, isolator is not needed.
Not required, sir. It very clearly states that minimum duration is more than 4 hours is what is required.
Okay. Can you refer which guideline I have to follow that?
Yeah, I will share you, sir. You can
Okay.
personally ping me. I'll just get you that scholar documents.
Thank you.
Sure. And ventilation control strategies, as I already told, respiratory problems are the high rise. 70% of people are having this respiratory. That's why we are more talking on respiratory ventilation and control strategies, because most of the dust or the particles that are inhaled only. So the problem starts with breathing difficulty or restlessness or whatever. They prefer with, sir, I have some kind of breathing difficulty. So that is where the ventilation control strategies also to be taken place. Most of the places are now ventilation, it is given in a proper exhaust. But some of the places where it is confined, then you should very much look into it, where you are exposed to a smaller dust particles or fumes or whatever. And air cleaning, most of the companies are now having, as per the regulatory standards, they are having the air cleaning exhaust and cleaning of the exhaust and other things. But some of the places where we go on audits, we see that it is not clean for a longer time, because they say, sir, people are only exposed for smaller time, or people don't go frequently to that area. No, that is not the sense. The periodical cleaning of the exhaust should be done even if the person is not entering there for a period of time, because the confined space may it take more of molecular gases inside. We don't know which type of gas. We are not evaluating every time before entering into a confined space. Similarly, the cleaning should be in a scheduled sense. That's why we are mentioning the cleaning should be in a scheduled maintenance. Advanced monitoring technologies like real-time sensors, and now we all have a wearable technologies like you have your watch, whatever, to like throughout the shift, and where you are getting the peak of your heart rates or respiratory rates and all those stuff. And predictive analytics, it gives the algorithm, it gives the data, and based on that you can have your predictive analytics. And mobile laboratories, that they are working now more on mobile laboratories, because previously the evaluation took longer time for the data to get back, but now it is mobile, immediate results, immediate technological changes, and they give you the solutions. And they are working more on mobile laboratories. Soon it will be enabling rapid decision making during the investigations. And PPEs, as I already told, it's the last line of defense. Do not trust mostly on PPEs. PPEs are only used self-sufficient, not the people sufficient. You all know this PPE categories and applications: hand and eye, hand, foot, body protections. But as I already told, respiratory protection programs, please ensure medical clearance is given, whether it is fit, they are able to wear the respirator properly, or they have any other underlying health conditions. Some people don't get the fit testing, then they'll eventually end in the face piece issues. Also, please ensure you select the proper for the proper person, proper respirator for the proper person. And the maintenance protocol, you tell that worker when it is to be cleaned, when it is to be changed, when the cartridge has to be removed, cleaning, as I told, cleaning, inspection, repair, and storage procedures of the equipment reliability. So we have air purifying respirators and atmosphere supplying respirators. Self-contained breathing apparatus, we all know, for the air respirators, and powdered air purifying respirators, we all, PAPRs are, right now we are using more of PAPRs than SCBS. So this is the critical fit testing consideration. Quantitative testing, it's only instrument-based measurement of the leakage. Qualitative, it is based on the odors, irritant smoke, odor vapors, or taste testing. This is more acceptable for negative pressure, half-phase respirators in some applications. It completely relies on whereas sensory detection of the test agent leakage. And annual fit testing mandatory is minimum that we need to documentation. And recent emerging PPE technology is the exoskeleton technology, which reduces the musculoskeletal ergonomical issues and other MSDs, musculoskeletal disorders during lifting and repetitive tasks. And this is the main that we are going to talk on today is ergonomics and occupational health. Most of us are humans. We are working. AI is replacing, but certain places where humans cannot be replaced also there. That's why we say human-centered workplace design, where optimization between the human and the AI is more required to understand and research. So this discipline seeks to optimize human well-being, because MSDs are most significant, because most people present with MSDs 70%. That's the real scenario in industrial setups. The current data says 70% of the people are having MSDs in any industry, because lifting, there is no proper training, or even if it is trained, they are not doing the proper lifting techniques. So finally ending in medical treatment and human sufferings. So the ergonomic interventions reduce the injuries and often improves the efficacy and quality. So what are all the risk factors that we should look for is force, what is the magnitude of the physical effort they are going to lift, and how frequent they are going to do that, and what is the posture, how they have to lift, positions and angles, and what is the duration of the length of exposure. Is there any oscillatory motion which is involved? And as I already initial slides I told, thermal stress. These are the 6 things that is more important in considering an ergonomical risk factors. In your industry, please fit into these 6 categories, whether it is repetitive, whether they are going to do this posture for a prolonged duration, whether is the vibration and temperature going to play a major role. Force, it depends on the individual, because it cannot be fixed. It varies from individual to individual. So how can we prevent the work-related MSDs? We all know what are all the parts affect: muscles, nerves, tendons, ligaments, joints, and spinal disc. I'll just tell you in a nutshell understanding. If we want to lift anything, we are using our hands. We are just picking an object. We are picking an object. For this object picking, we need muscles and the nerves behind it, and for that the ligaments which is attached, muscles, nerves, ligaments, and the blood supplies. So when we are constantly doing this on a repetitive phase, this gets weakened. Anyhow, the blood is going to get supplied. It is renewed, but the muscles, they get sore. That is why they get the pain. Pain is the first symptom that is exhibited by the patient in a musculoskeletal problem. But what is the sign? Basically, you have to understand between two things: what's a sign and what's a symptom. Sign is what we see, symptom is what the person says. So symptom, the person who is working says pain, but what could be the sign that you can see? Anyone can say what is the primary sign that any person you see that they are having MSDs? Can anyone say?
So, vascular veins, so they are visible.
Yes.
They start deformity in that. Thank you.
Yes, varicose veins. No, but I'm not talking, because in industries, mostly in industrial setup, they wear complete dress. Varicose veins, if they're wearing shorts or whatever, only in exposed areas we can see. But a sign, a simple sign, what we can see in a
White
person who
fingers.
is repetitively
White
doing that
fingers.
job.
Doctor, is it white fingers?
Exactly. And one more, fatigueness. We oftenly see people, they just
Doctor,
sit
and
idle.
it,
They sit
doctor, and
idle.
the numbness, white fingers and
Numbness, yes.
numbness.
Yes. They
Numbness
sit
and
idle.
fatigue.
First thing is they sit idle. They're doing the job, they sit idle. Only when you go and ask what is the problem, then they will say all these things. But classically, they will not. One thing that you could notice is they will not stand straight. They will be just body standing whichever side they are comfortable. Have you ever seen people standing on like the cross sides? Because the hip and the knee joint is what making the person's weight bearing capacity. So what will happen when it is more of repetitive things? One side gets more strength and one side gets weakness. So they tend to stand on weaker side. So it is in order to relax the other muscles. That is the first sign that you can see. Subsequently, you can go and ask them, they will say this numbness or whatever. But first thing is that change in the posture, the standing posture. That is the first thing that you can see. Or some people even lift their heel, one heel lift, and they will stand. Only one heel will be on floor, and one heel will be like lifting on the other toe. So, as we already know, Ray-Ban ruler, rapid upper limb assessment, and rapid entire body assessment. These are all the now softwares are there. You put the value, it gives you the ergonomic assessment. That's how the AI is taken over. But work, work desk, and workplace all varies. A system desk job person will vary from a person who is lifting the weights of 50 kg bags or something on the shoulders, and they are loading, unloading, offloading people. So the Nailesh lifting equation, it calculates the recommended weight limit for manual lifting task, considering horizontal location, vertical location, and the distance, what is the asymmetry, frequency, and coupling. So this is the widely adopted standard rather than Ray-Ban ruler. Strain index, based on the industry, it varies. How much intensive that they are doing the job. As I already told, workstation design principles already there. You go Google, you get everything. What is that? What is the height that you have to keep? What is the 90-degree hands you have to keep on the table? And what is the visual distance that you have to keep? All this workstation design principle. This is a outline of what is the design principle. As I already told, we are more focused on industrial safety. Yes, safety has come to a part where it has become a regular standard utilization of every individual in the industry. Because when you go inside, you wear safety shoes. Without safety shoes, you're not allowed. You have to wear goggles, you have to wear safety helmets. So safety has become a part, at least 60-70% in an industry, that it has become a part of people's life. But what about the other factors? Previously, it was safety, health, then safety, health, environment, then safety, health, hygiene, environment. So say, now it is evolving. We are evolving. Safety only we are focusing, but right now we are in a phase where we should start focusing about the other things around safety, environment, and the health aspects. That is where occupational health surveillance starts. What is it? What basically it tells? It collects the data, analyze based on the amount of people they are coming and utilizing the health services, work related illness or seasonal illness, differentiating between the both, and the control and effective measures. Basically, people will come, they'll say, sir, cold. Okay, you are having cold, you get treated, you go. But you come again after 3 days. Sir, I'm having cold. Again. Then we have to think why this person is getting frequent cold. Then you evaluate his workplace where he is exposed to small fine dusts. That dust has become respiratory problem for him to get the cold. So, similarly, this differentiation makes a major difference between a work related illness and a seasonal illness, and how to control these effective measures. So, baseline assessment, pre placement examination, before joining, pre-employment evaluation. Now it has become pre-placement. First thing, baseline evaluation should be documented. Second thing, periodical. After 6 months of confirmation or 1 month, what is the change that 1 year? What is the change that the employee is going through? Then periodic, and then biological monitoring if it is for a specific workplace. For instance, if a person is exposed, as sir I already asked, the amount of exposure for a different people varies different times. So for those specified people, biological monitoring, urine sampling or whatever has to be done. Lead industry is another. So this biological monitoring plays a role. Finally, data analysis is to ensure that this is occupational, this is non-occupational. On non-occupational front, what are all the medical camps that can be considered to make employee morale strengthening in perspective of health? And in case of occupational, what are all the changes that we can bring out, like hierarchy of controls, engineering controls, or whatever the administrative controls, what can be changed, how much you can distance the worker, or how much PPEs needs to be addressed, or whether he needs a full suit or what. So these kind of all things will come out with a data analysis subject. And as I already told, integrating occupational safety and health with environmental stewardship. This is right now more important because we are going for a target of 2030 and 2040 target by our Prime Minister of carbon footprint. So, environmental sustainability and occupational safety share fundamental principles like prevention of harm, life cycle thinking, continuous improvement, and stakeholder engagement. These 4 points I needed to emphasize. It is prevention of harm, how the environment is going to affect our own life or our own health is the prevention. And what is the life cycle thinking? And what is the continuous improvement that the industry needs as well as the individual needs? And the stakeholders' engagement in this both perspective. So, forward thinking organizations recognize the synergies between protecting the worker and protecting the planet. So, process modifications can be considered for both worker health and environmental performance, energy efficiency improvements, and cache projects can be considered, integrated management systems addressing safety, health, environmental, and quality objectives, which streamlines the compliances, reduce redundancy, and foster the holistic thinking about operational impacts. So, what are all the impacts? Air quality, we already do the samplings. Water resources, most of us we don't do the water resources because we think only two aspects of water. One is the drinking water, one is the process related requirement of water. But what we need to think more is that how we are going to discharge the quality how we are going to consume it, and what should the impacts, and how we are resourcing depletion of the resources, and waste generation, solid and hazardous waste requiring management and disposal. I think already we have a lot of guidelines on this hazardous waste management and solid waste generations. So how we can prevent source reduction, recycling and reuse, treatment maybe to reuse the same, and disposal. The disposal should be considered as a last option unless it can be reused and it can be recycled for the same. In an industry where we went, I'll just say an example. The solid waste was generated. It's a piles and piles and tons of tons. Eventually, one engineer from the same company, he just came out with an idea of mixing the sand along with that molecule, because it's also solid waste, sand along with that molecule, and make into bricks. Eventually, it was made into bricks, and the whole company, I think the company was about 14 acres. The whole company's compound was made with that bricks, what the engineer has. Disposal cost is, for example, 10 rupees. The making cost was only 2 rupees. So this gave a huge savings to the company. So thinking about more of recycling and reuse, this happened in one industry in Ranipet. Why cannot it happen everywhere is the question mark. So as you all know, sustainable chemistry principles like substitution of hazardous material with alternates, bio-based materials, renewable feedstock, and other stuffs. So as I already told, energy management and carbon reduction, we are more focused on energy efficiency right now. We are more shifting into the renewable energy format, and we are on the real-time performance monitoring of the carbon reduction. So climatic change also impacts the workplace safety through increased heat stress. This year, you already know, we are having different type of climate. It's still, we are not into the heat mode. We are still having more of cold. So the climate is not predictable nowadays. It is changing day by day. So increased heat stress, severe weather events, altered disease vectors, and supply chain disruptions. Heat illness prevention programs, definitely three things you have to do it for an industry. In during a winter season, please ensure that your employees or the workers are given more of comfortable drinks for the prevention of common colds or whatever. Like during the COVID times, you would have already seen this Kabasura Kudineers, and but we still follow giving the Kabasura Kudineer every cold season. We give it a weekly, twice or thrice based on the need, and during the heat stress, we give buttermilk or whatever. So these things standard that we need to ensure that they have both the ends. During this season, we have to give more, making them more rehydrated, and prevention of dehydration, what I mean to say. On the other sense, prevention of cold and common diseases, because it spreads through the company, so it affects the sickness. It goes into sickness absenteeism. And what we are going to go forward is like building a resilient safety culture. How we are going to be resilient is more important. Leadership must be demonstrable, visible, and through resource allocation. Personally, we have to engage and take the accountability, is what being resilient. Worker participation is usual. They will have the safety committees, hazard reportings, and improvement, but that is not what we need. Going forward, there should be a cultural related principles. They should take the accountability. They should start learning. They should be like, they should give us some suggestions. It's not just participating in a discussion and say yes, 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 sir. Okay. No, we have to make sure we hear them, so that distinguished system, it also gives a resilient safety culture. So these are all the key performance indicators what we have as a data. So the 0.89 total recordable incident rate per 2 lakh hours worked, industry benchmark comparison. 47 near missing reports per month indicating proactive hazard identification, and minimum of 94% training completion is required. So LTA, we all know, LTA, we are trying to avoid, we are trying to balance things, but LTA is not the last sort. we have to ensure. See, that is a learning, but how we are going to learn with that is what more important. So we will have to try to balance all this by like what to say, we are not strictly adhering to something. It is like we need to grow, we need to adapt, we need to take it forward. So don't get down by a mistake. It is like learn with the mistake is what more required. So continuous improvement methodologies, PDCA, we all know, plan, do, check and act. So initial assessment phase, development, implementation, and then monitoring and improvement. Basically, each and every industry should have environmental sustainability. You have to do it so that it is going to give a breakthrough impact for your workforce. As I already told, I have come to the conclusion of what topic that we have already spoke. This is some additional thing apart from our regular schedule. As we all know that we are in a regulatory shift from Factories Act to OSH code. So Factories Act, we already know Factories Act 1948 is going to be replaced by the OSH code 2025. What are all the key differences? I'll just tell. So after a long time, even we are in this process of getting a new code. Factories Act previously it gave traditional approach focused primarily on physical safety measures. As I already told, safety, safety, safety. So it didn't have more of health provisions. No first aid requirements was not detailed. So preventive care was not spoken at all. It was a narrow regulation. But the OSH code, which all the codes are brought into one section, migrant workers, each and everything. So this is a holistic framework embracing comprehensive employee well-being where mental health integration has taken place, wellness programs have been mandated, continuous health engagements, technology-driven monitoring, expanded service requirements. As you can see, this OSH code is more focusing more on occupational health. Occupational health center is what is being focused in this. So what you need to know, they are very clear mandatory OHC establishment in industries, proactive health focus, because we all have stress. Without stress, we are not living. So any disease you put it, you easily you can tell I have stress. So that's how stress is working nowadays. So the system is going to go focus more on health oriented mental physical well-being. So it will be more proactive rather than reactive. So proactive health focus will be there. And what are all the compliances? More of health surveillance is being added. Why they are a game changer? Because it gives a broader scope to all industrial sectors, including MSMEs. Because previously MSME didn't have a regulatory framework. So preventive healthcare focus, strict compliance, and now technology integration. As you all know, even the dish data is being imported in a digital format, which is mandatory. You have to submit your digital health record of your employees, data reporting, and continuous monitorings. So what are all the key provisions? I have given annual health examination for specified hazardous process. If your industry, if you are classified under 2CB, which is a hazardous process or major accidental hazard or any kind of listed 29 hazardous process, if you are having annual health examination is must for all the employees across. Previously, it was specified only that you have to do the medical checkup for people who are exposed to that particular point. No, it's going to be for all going forward. Enhanced welfare facilities and working condition standards, strengthened provisions for women's safety and night works, and in the chemical accident rules, updated notification and emergency response requirement for major accidental hazards, mandates the detailed safety reports, on-site emergency plan and off-site is to be evaluated every year, and public disclosure also should be done. Reporting requirements, serious accidentals should be reported within 24 hours. Dangerous occurrences documented and investigated by the government agency as well as our internal forum. Annual safety performance reports should be submitted. So this is the key line difference between old and new. More of why I'm telling is they are focusing more on health perspective, which includes environment as well. From compliance to care, that is what the new industrial health paradigm is working on, and creating a resilient future together. So I just wanted to read this because I wanted to understand what is the whole topic today. The integration of occupational safety, health, hygiene, and environmental sustainability represents both moral imperative and strategic advantage. Organizations prioritizing worker well being and planetary stewardship build resilience against emerging challenges while attracting talent and maintaining the social license. By protecting people and planet simultaneously, we create a workplace where individuals thrive, communities prosper, and operations remain viable for generations to come. And I want to put a small quote here. That is my usual quote in all my presentations. I usually tell eco-friendly environment plus sufficient safety is equal to harmonious health. I say sufficient safety can be determined place to place where you need not wear all your safety PPEs at a place where you're entering. So sufficient safety, eco-friendly environment will give you a harmonious health. This is my keyword in my usual presentations. So thank you for giving this opportunity, and now we will go for question and answer sessions.
Thank you very much, Dr. Nailesh.
Yes, sir.
It's a lovely session, very insightful. Okay, we'll keep the floor open for question and answers.
Yes.
See, we have Mr. Mahavir, the president of the Chemical Traders Association.
Yes, sir.
Mahavirji, can you say a few words?
Just a minute.
Mahav,
So,
yeah, go on, Gopinath. Go on, Gopinath.
so no. Proceed, sir. Proceed.
Mahavir, Mr. Mahavir. Okay, we'll keep the floor open for questions. As and when Mr. Mahavir joins, we'll ask people.
Yes.
Yeah, Gopi, please go on, Gopi.
No, sir. No. Proceed, sir.
Yeah.
Everything is fine. Nice presentation.
Dr. Nailesh, can you keep that presentation the fourth slide? I think that the PP is the last thing you showed, no?
Yes,
Step by
sir.
step, the first one, 7 layers or 6 layers or something like that. I think 6th or 7th slide. I think.
This one, sir.
The 5, 6 are levels, no? The levels. Yeah, this one. No, this before that. Now next come down where PP is the last one you said, no?
PP is the last source. Yes.
He is asking hierarchy of
hierarchy,
risk,
yeah.
hierarchy of
hierarchy.
risk control.
Yes.
Hierarchy of risk control.
Yeah, right. No, this is not this. Slightly above. Right, this one.
This
Thank
one
you.
only. I gave this personal protective equipment as last resort. Yes, sir. In this.
You have to first eliminate it. Avoid it. Okay, you can't avoid it. One of the risk substitution.
Eliminate.
Engineering control. That's protection.
Now, my question is, the first step you said elimination. Before elimination process,
Yes, sir.
how to identify what kind of hazards we are facing over there? You have classified into different kind of hazards. So classification of hazards, identifying it first, then only we can go for elimination, right?
Yes.
Yes. Okay. So this
Obviously,
is only risk
no.
control.
I have here mentioned about the risk control hierarchy.
Control. Yeah, I understand. Yeah.
Because identification is already done.
Yeah.
How we are going to control is what? First, we'll try to eliminate.
Okay.
And if elimination was not 100%, then what we can do is like substitute with the same. So similarly, like we'll try to go one by one. But I'll try maximum to eliminate. But 99% of the cases you cannot do it because maybe it could be a raw material or maybe it could be a process related. So you can
Bleed is also carcinogenic, but not that to the extent of benzene. So
Correct.
we have substituted with we can't eliminate the solvent, but we have switched over to toluene. That is a substitution.
Orthotoluene. Yes.
Yeah.
True.
Thank
Some
you.
most of the cases, sir, let us be practical. Whatever we
Right.
speak theoretical, yes, it is. But Anna, let us go to the ground level. We cannot achieve 100% of anything because
Right.
either we will be investing more or
Right.
either our profit will be less. In either way, as a top management, we will not be ready to go ahead.
Right.
But நம்ம என்ன finally what we will try to do is what best can be done and what best can be avoided for the human exposure. நம்மளோட
Right.
மெயின் கன்சர்ன் இங்க
Right.
எல்லாத்துலயுமே பாத்தீங்கன்னா நம்ம will come only to the final output of human exposure.
Right.
So அப்ப ஹியூமனுக்கு என்ன ப்ரிவென்ஷனா பண்ண முடியும்ன்றத at a lower cost will start working. Eventually இல்ல சார் இது எனக்கு ஆப்ஷனே இல்லைன்னா ஓகே ஒன் டைம் இன்வெஸ்ட்மெண்ட்டா ஓகே வாட் இஸ் ROI-ன்னு பார்த்துட்டு we will try to do.
Yeah, I understand. Now, see, the recent thing is we have started working on integrated on-site and off-site disaster management plan we are preparing. For
Oh.
example, for Vedanta, for this thing. So,
Nice.
on-site is regular thing. Off-site is,
Hmm.
it was my responsibility using cultural, social, economical, other areas, the facility of the community living in and around the facility, because most of them are contract labors. So, we have to take care of them also. So we do an offsite integrated disaster management plan also. So now
Okay.
WHO talking about earlier it is when you say health, it is only physical health. Then later it became a mental health.
Yes.
Okay. Now they talk about one health where physical health, mental health, animal health, occupational health, and environmental health. All five together we make one
True,
health,
true.
which is
இல்ல சார் இப்போ ஹெல்த்
wellness.
மட்டுமே இட் ஹஸ் given even இன்னும் 3 more ஆட் பண்ணிட்டாங்க which includes financial health also.
Right, right.
Different the aspects are getting added because the and the humanoட tendency எங்கெல்லாம் வீக் ஆகுதோ அதெல்லாம் ஹெல்த்தோட பெர்ஸ்பெக்டிவா கொண்டு வராங்க.
Very true. Now, considering this animal health, do we have anything connected to this thing, what you have been talking about till now? So, for example, even though it is not directly connected to the factory or a unit, the animals living in and around the facility may have some
Yes.
bacterial infection that may cause also this thing. So,
True.
what kind of prevention or awareness you are creating or you are including as an SOP in the disaster management plan preparation? Do you have
True.
any idea about that?
No sir, இப்போதைக்கு I don't have, but ஆனா one thing that what I will tell you is ரெண்டு விஷயம் தான் சார் that we are focused. One is the stray dogs.
Right.
Mostly industries-குள்ள இருக்கிறது பார்த்தீங்கன்னா stray dogs தான். They breed, they eventually cause more of the infection control-க்கு வரும். Second
Right.
thing is pigeons.
Right.
Pigeons ஓடது as we all know we are suffering more. இப்போ மும்பையோட சினாரியோ எடுத்துக்கிட்டாங்க we
yes,
have a
yes,
recent
yes.
input. So
Right,
the suffering of respiratory issues. Third is
Right.
the monkeys. இது மூணு மட்டும்தான் மெஜாரிட்டி ஐ திங்க் பீப்புள் வில் அண்டர்ஸ்டாண்ட் மோஸ்ட் ஆஃப் த இண்டஸ்ட்ரீஸ்ல இது மட்டும்தான் மெஜாரிட்டியா இருக்கும். இப்போ இந்த மங்கீஸ் விஷயத்துல யூ கேனாட் ஆஸ் டு புட் அ ட்ராப், தென் இட் பிகம்ஸ் அ ப்ளூ கிராஸ் வயலேஷன்.
Right.
இப்போ அதுக்கு லைசன்சிங் வாங்கின ஆளுங்களும் கிடையாது. ஸோ தெர் இஸ் நோ SOP ஃபார் தட். ஓகே, ஃபார் pigeons obviously we don't, because we don't know where they will start, where they will accumulate. One place to other place they paradigm shift கொடுத்துருவாங்க. பட் ஸ்ட்ரே டாக்ஸை பொறுத்த அளவுக்கு நீங்கள் என்னதான் யூ கேட்ச் தம் அண்ட் கோ அண்ட் லீவ் தம் அப்பார்ட், தே வில் எவென்ச்சுவலி கம் பேக் டு த சேம் பிளேஸ். ஸோ லயபிலிட்டி பார்ட்டில் பார்க்கும்போது தெர் இஸ் நோ SOPs அட் பிளேஸ். Maybe this is a point where we can ponder more about how to create an SOP in this perspective. It will be useful for most of us.
Now, why I raise this question, because whenever after completing a disaster management plan, especially Shivakumar will join later, so the collector of that particular district will always request us to present before implementing that. See, for example, in Barmer, in Surat, all the district collectors, they will invite all the official line officials, and then we are asked to present in front of them what kind of SOPs we have worked out, so that the district disaster management authority and state disaster management authority and even national disaster management authority are very open. In case of new ideas, they are ready to include in their guidelines as the national guidelines and include in the National Institute of Disaster Management curriculum also.
True.
So that is
NDRF
why
team
I'm
கேக்குறாங்க sir. NDRF team, they're very fond, they're favorable, and they're also asking. It happens same.
yeah.
Yes, true.
That is why this forum, I'm just making it the open forum, that if you
the
come
job.
across anything new, you can also present it, which we can discuss and we can
இந்த
recommend to the
பாயிண்ட்ல
district and
யாராவது
state.
ஒர்க் பண்ணா நல்லா இருக்கும் சார், because across it will be useful sir.
Yeah, it will be very useful because most of them are working or owning an industry, so it will be a very good suggestion
True sir,
from my side.
true.
Thank you.
Sir Ravichandran sir, you have raised a hand.
Yeah.
Yes sir.
Good morning. I'm Ravichandran. I'm a farmer basically.
Yes.
So farming. So most of the more than 50% of the people are engaged in farming.
Okay.
Farming, there are a lot of occupational hazard. I'm one of the victims. I had that aspergillus.
Oh,
You know,
aspergillosis. Okay.
Yeah, yeah. So I used to be in the farm during harvest. The dust entered my lungs and it caused a serious problem, bleeding and everything. Similarly, there are a lot of hazards in farming. For
Yeah.
instance, spraying chemicals. We cannot do away with the chemicals because we need to address the problem of food security.
True.
But no protective gear. Nobody follows that safety measures. So there are no system in force. And, as I said earlier, and a lot of lung-related diseases, like in Delhi and Haryana, they burn this stubble, and passively it affects, non-farm people also. So these
Oh,
are some of the things, and even skin-related problems. So my workers, they often have this kind of fungus,
true sir.
infection
True.
in the farming, the farm workers. So there is no system in force. I think so. Majority of the people in India, they are engaged in farming, and there should be some kind of system in force, sir.
Okay,
Thank you.
sir. I'll just give a input on this, sir, because I see or in a week I'll have at least 3 or 4 dermatological problems with this occupational exposures. Yes, you are right. In farming, most of the people. The thing is that, sir, in an industrial setup, statutory regulations are based பண்ணி தான் system functions. So what happens? The statutory kaga, it works more to make sure things are in place, and it is given in it is like overlooked into. But in a farming setup, SOP is mentioned in the box. It is mentioned avladane thavara, it is not being followed. Now, as per your suggestion, this has to be or enforced பண்ணலாம். But how it will get enforced in a shop floor, அதாவது dead endல பார்த்தீங்கன்னா how it will get enforced? People, the owners or the commercial people has to be enforcedங்கிறது தான் இதில் ஒரு பாயிண்ட்டாக வந்து நிற்குமே தவிர, it is the individual who has to choose, who has to changeங்கிறது தான் என்னோட perspective, sir.
Yeah, you cannot make it mandatory also because
Yes.
small farmers, they simply ignore the safety norms.
Exactly.
It's lack of awareness, lack of
Yeah,
education.
yes. In the awareness sessions, we can improve. But as a final thing, sir, in a small setup or where dead end people only working, na awareness should be like self. The self awareness vanda mattumda things will change. Otherwise, it will not change because, as I already told you, in the average நாங்க பார்க்குற cases, 60% of the cases eventually end in cancerous changes. This is the real scenario. We have to accept. But they are saying, sir, எங்களுக்கு we are not aware. நாங்கள் அதை படிக்க தெரியாது, whatever. But right now they are facing this issue. Going forward, I think this awareness campaigns can be conducted. Maybe please include.
Yeah,
Yeah, no, I just want to add one point. This is a very good suggestion because we have recommended this as part of the CSR activity where most of the industries are having it over there. Now, the community-based disaster management plan, which we have designed for communities, we have trained them, and part of the CSR, even Vedanta Group and SR, Tata's in Surat, and oil industries, mostly they are utilizing. Maybe this suggestion of what you are saying, that awareness creation, could be part of the CSR activity of that respective industry.
Mostly, sir, it is good if it is a part of CSR. Also, I am saying, if, for example, Ravichandran sir is there, his locality, he can ask some of us like us to give a awareness talk. Like we
Maybe
will do it
NGOs,
from our end.
you can,
We'll go on.
Yeah.
Let us
Right,
start
sir.
this. Let us lead this. let us grow. All of that. And I am
Thank you,
ready
sir.
to give this awareness
Yeah. Yeah.
session, sir. So you
Yeah.
can
Again, in collaboration with the chemical industries, we can,
definitely, sir.
farmers and
Definitely.
some of the farmer leader like me, we could
This
organize
is a
such
great
meetings, sir.
insight. I think we should work more on it, sir. I think
Thank
Suresh
you.
is
Dr.
the
Thank you.
right
Nailesh,
person to do it.
Dr. Nailesh, there is some chat box. There are some requests are there. You can put your contact number and email ID so that they can keep in touch with you.
Sure, sir. We'll do that, sir.
Hello,
Yes, sir.
Dr. Nailesh. It was very good presentation.
Yes, sir.
Myself, Shiv Prasad Nikam from Mumbai,
Thank you, sir. Yes, sir. Please, sir.
and I am EHSS professional, having 34 years of experience.
Okay.
And currently, I am running my own company in the EHS consultancy. I work for mostly MNCs, that is to pharmaceutical like Pfizer, GSK, and Unilever.
Oh, that's great.
So your presentation, I was remembering my old days where I was doing actual monitoring of the people.
Okay.
So it was really good connect for me.
Yes. So technology changing, people are changing. Obviously, we are also changing, but
Yes,
people like what to say, early phase it was very tough for us, but right now people are at least 10% their listeners.
yes.
Make them grow a little more.
Yeah, only thing, yeah, as you rightly said, awareness is coming within the industries also, because people just think that safety is limited to helmet, shoes, and safety belt, or maybe
Exactly.
that goggle. But
Exactly.
they go beyond that and see the things in terms of the occupational hygiene or ergonomics for that matter.
True.
And I am DISH approved auditor currently. So I
Oh,
audited more than 70 industries, including hazardous process and MH units. And even
okay.
those companies also, they don't have the that much knowledge. So it is
Okay.
a big gap, I would say. And when we talk about all these things, they really, oh, is it so? Like this, we need to. They are conducting the ambient air monitoring and they are showing the reports as a workplace monitoring. That is a
Mm,
sad.
mm, 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 mm.
Yeah.
True.
So here, yeah, we need to create a lot of awareness and bring this
Sir,
to the.
first of all, as I already told in my previous things, sir, for India, we don't have our own guidelines, sir.
Yes.
We have to create our own guidelines for Indians first of all. That is what I suggested, and now Tamil Nadu Dish, Mr. Anand sir is doing that great work, and we are all supporting him. But similarly, it should happen once the new OSH code is launched. I think this will also be there. We are expecting the same by 2026, sir. We'll look forward, sir.
Yeah.
But
Well,
parallelly, if the forum here, a lot of people are here, let us all give our own contributions in our own field as a part. You can send it to me. I will compile and I will send it to the directorate office.
yeah. Whenever any recommendation or any observations we give in this space, they directly link it with to, is it legal requirement? First question.
Yes,
Where it is not legal requirement as per our, if you really talk about this one, because it is broadly said you have to take care of your own person. So by how,
correct.
what means they really don't interpret and put the things right in place.
Sir,
That is the.
that is what I am trying to tell you, sir. It is a very good plus point for us, sir, because we can create our own what is the requirement. See, because the guidelines is vague enough. You can fit in anything. If you are not following the guideline, then they will question you. If you are following that guideline and you are going a little advanced, they will not question us.
Yeah.
We
In
are
fact,
not going into that next step because we think, why should we do that? Why, if we create the system, people may accept, may not accept. Things will like we are in that phase. We have to break out that point and we should go a little advanced so that even the government will not question us why you are doing this because we are doing for our own employee welfare.
yeah, but recently, one good example, I would say, one of the industry here in Maharashtra, which is in Boisar, place called Boisar. It
Mm-hmm.
is little bit again pharma hub, we can say. So
Mm-hmm.
one of vice president approached me because he knows me during my GSK
Okay.
time and all the time, and he
Okay.
wanted to bring one new product in their premises to make like in injectable.
Okay.
And, it is a TINI category API.
Mm-hmm.
So he thought, let me check with Shiv Prasad sir, and then only if you are able to make it, then only take it, something like that. Then I gave the entire study because it was falling under OEB 3, in between OEB 3 and 4, because
Okay.
MSDS was not speaking that clearly what OEB categories it has. So I
Okay.
given all this kind of thing, what should be the engineering control and all everything. I made the report and given to them. And see the things, if you are only able to do this, then only you can take this. Otherwise, say to your client, or you have to invest to
Definitely.
put some control measures like closed loop transfers and all those things. So this is also one good example, I would say. Going forward, what they will be doing, I don't know, but at least people are approaching for this kind of.
No, this is a valid point, sir. You have given a fire lit up here. Maybe we'll all try to take forward. That is what, sir. This networking is going to be productive for both you as well as me. But this networking is not for you or me. It is for the society,
Society.
where the industry which we are representing. Like Suresh sir, he is the like I have never seen such a person who is working more towards the society aspect. What we started learning from him, that is what we are here now. So like there are people, there are pioneers already there. Let us start working together. At some point of time, sir, our work will be valued, sir.
Yeah.
That is what I would suggest.
And I could hear one of the gentlemen, he said he's a farmer and affected badly on the occupational hygiene point of view. Again, this is one of the area we need to take up because
I'll tell
earlier,
you one thing, sir. Occupational health, industrial hygiene, they both are different terms, but at the end, it is going to be the worker's health.
worker cells. So
So,
from that agriculture point of also, because a lot of farmers died
exactly,
during the pesticide spraying and all, not having the awareness, they will
true.
just put their towel which is put on the head, just they will close the nose and they will do the spraying.
Exactly. This wet, the sweat is the wet. It is easy for transmission, inhalation.
Inhalation. And this
Most of which
again unorganized sector from occupational hygiene or that kind of. So government has
lack
attacked
of
the building and all the
industrial
construction.
hygiene knowledge in most of the industries are now we can see, sir.
Yeah,
Because all the industries and all the everywhere, safety is 90 marks out of 100 now. But
yeah,
industrial health and hygiene, we are 10 marks out of 100 now. That is the reversible scenario that we have gone to.
yeah. And another worry is that when we are doing the sampling, we don't have that kind of laboratories in India to analyze that sample and give the interpretation.
True.
Currently, we need to send all the samples to ES to Bureau Veritas or something.
Now it has come, sir. Now even Bureau Veritas, like we have a competitor for Bureau Veritas also. Indian we have. That is what they are evolving. Soon or later, we will be doing for the US companies. That is how
Okay,
we are growing.
okay, great.
Yeah,
Yeah, maybe we can be in touch. I don't know whether you shared
definitely,
your
sir.
number
I
or I
have
can
shared
take
my
it from
mail
Mr.
and
Gopi.
mobile number. Please be in touch, and let us all be in touch with Suresh sir for different these ideas, so that we'll put it in in ground.
Great, great. So, do you
Uh,
possess CIH certification?
Sir, pardon?
You are CIH, Certified Industrial Hygienist?
No, sir.
Okay.
Doctor, I'm
Yes, sir.
Krishnamurthy.
Yes, sir.
See, next week I'm planning to conduct one sanitary workers for Greater Chennai Corporation. Sanitary workers health program I'm planning.
Super, sir.
So we're going to conduct. And
Nice.
we used to conduct behavior-based safety for people in Serum Fibers, Manali.
Super, sir. BBS da இப்போதைக்கு தேவை. Need of that. Please.
So we conducted two programs for Serum Fibers, and the people are very much interested. Not only people, but management came forward to recognize this topic as a value addition program.
Nice.
Thank you.
Sure, sir. Any other questions, sir? If it is the case, Gopi, sir.
Yeah. Anil Goswami, sir. Would you like to add anything, sir?
Pardon, sir?
Anil Goswami, sir.
Thank you, sir. Thank you. So,
Thank you. Thanks a lot.
lot
Thank
of
you.
awareness.
Thank you.
So the challenge in small industry.
Awareness now. I remember when I was young and I started my career as sub-division officer in government. So there was a huge mattress factory just behind my wall, and I was crying that I was inhaling all bad smell and pollution. but nobody was helping. Nobody was helping. That was the time.
Okay.
But
Okay.
now, fortunately, there is a lot of awareness. Suresa, that affected my lungs also. I was crying because the only fear was they will say, we'll get you transfer if you don't want to. Okay, if you don't want to occupy this office, we'll get you transfer. So that was the time. But now there is a lot of awareness. Thank you very much.
So I just want
Still,
small
still,
scale.
still lot of yes, still lot of things have to be done because I see I have worked in now I'm retired since many years. Now I also worked as general secretary for last 4 or 5 years. So even water sample we want to take, but again the constraint in our mind, there is anxiety in our mind in case it fails, how we provide the best water, how we provide the
Exactly.
best water.
That's what I mentioned. Yes. True.
That is
True.
the
True.
that is the problem. What to do because the alternate is not there. Thank you.
Thank you,
Nailesh,
sir.
sir, how is the weather in Delhi?
So quite
Good,
cold,
sir.
sir. Now since yesterday it is better. Since yesterday.
Okay.
We can see the sun, sir. Suresh sir, we can see the sun. So almost
So, Dr. Nailesh,
Yes, sir.
one issue
yes.
in small industry. I'm right now today on a Sunday also. I'm sitting. Uh, if you insist them wearing PPE, they quit. I mean, it's very difficult to get workers.
True, sir. True. I accept. Yes.
And I'll tell you. I mean, I don't want to mention name. I mean, 40 years back, there's this uh, company manufacturing chlorine, and they used to let it into the sea, and
Okay.
uh, the whole place will stink, and they used to give a chlorine allowance.
Okay.
And when pollution control board insisted that they do cleanup, I mean, they put a scrubber.
Okay.
The very workers who were I mean, who the pollution control board tried to protect went on a strike. They were afraid that this chlorine allowance will be stopped. So
Okay.
we will not allow this scrubber to be put, because then the management had to assure that even after putting the scrubber, chlorine allowance will be provided. So I used to, this is in the early 80s, I mean late 80s, and I used to be surprised how somebody can kill themselves for monetary gain. But now, even in Delhi, where highly qualified IAS officers, judges, and all Supreme Court judges are there, they'll rather kill themselves and their family, but still want to earn money or power or whatever it is. I am surprised. So whereas I am talking of workers in a chemical factory, but highly qualified people also don't mind killing themselves. It doesn't matter, as long as you make money and you are happy. I mean, or at least temporarily happy. So it cuts across all classes. So we should not blame the workers. Actually, workers have much less to lose, but highly qualified people also do that. Just by way of comment. But excellent. Thank you for this presentation, sir. Very
Thank
timely
you, sir.
also.
Short time gain, long time pains. They themselves die because of this. In the beginning, they enjoy.
Now, to answer Vishwanath sir's question in
Yes.
one word,
Yes.
after all, we are all humans, sir.
Dr. Nailesh,
Yes, sir.
Professor Vishwanath is from Anna University. So he is heading the
I'm a
department.
professor.
He's from-
Oh, okay. Nice meeting
Professor
you,
of
sir.
practice. Anna University.
Now the problem is the blinds are leading the blind. Many people and many people they in spite of knowledge they are just sleeping. You cannot awake them. You can awake a person who is real sleeping, but
No,
those who are
now
pretending,
people understood health is a main asset.
they are pretending to be sleeping. Now what to do? They pretend.
Now that people are started understanding health is their main asset, not money.
Doctor,
Yes, sir.
can
Yes.
actually are you taking care of malaria drugs also?
I, I'm a visiting consultant, sir. தேவைப்படும்போது for that.
I see, I see. Actually, we were using acetone for our
Mhm.
manufacturing process. That acetone was used in our centrifuge. It's a rotating equipment.
Yes, yes.
So what happened that when it is rotates, the acetone vapors will be spilled over
Correct.
the area, working place. So people used to close the door and run away. Once that until the operation is completed, they will be away from that room. What I did, I just put on hose and connect with one condenser, and the entire vapor of that acetone get condensed because of the high pressure, velocity pressure, and get condensed. So one side we eliminate the what do you call vapor pollution, and the other hand we started collecting the material. So two ways we were benefited. So like that, I made a lot of innovative ideas to do in Maladi drugs.
Very nice, sir. Very nice, sir. Very nice.
So a lot of things I have done, innovative ideas I did. So I'm very happy. I can recall all my innovative like that. In acetone liquid waste, it was collected in drums before I joined there. It was a 20 years old company when I joined at that time, Maladi drugs. So it becomes stored all over the plant. There was no place to say store it further. The pollution control board has demanded to remove it or trash it. Something they are gave pressure. They did not know what to do. What I did, I totally treated with sodium hydroxide, and all the chlorine contents were removed, and I started using in the boiler in one of our sister company. So
Correct. Correct.
the entire, as you said, the solid waste was, instead of keeping it and handling it, we disposed it in a safest manner in our boilers. So this is so many innovative ideas I did in Maladi drugs. Still, I could feel proud. That is why I chosen the safety.
Very
So
nice. Very nice. Very nice.
people's health is predominant in our business.
True, sir. And
Thank you.
answering to Vishwanath sir's chat message, yes, sir, we need to have a separate discussion on occupational health hazards, sir, because most of the companies like what they are calling me to give a talk on only occupational health hazard, because people should understand what is the cost of their health in. That's what I'm going, and I'm taking classes on exclusively on occupation. Recently I did it in L&T machinery. So what not they have L&T, they have everything. Safety is in place, but the people understood only after understanding what is an health hazard. So that's how it works. So yes, that is need of the hour, sir. We'll definitely do it, Vishwanath sir.
And there's another request from Mr. Vanchinathan, sir, requesting for a session exclusively on occupational hazards in
And
farming.
definitely, sir. Definitely, sir. If the forum gives me a chance, we'll do it, sir. Sure.
Sure, sir. Why not, sir? We'll definitely do session.
So thanks a lot, sir.
Thank you so
much,
much, sir. Thank you. I think we have come to the end of the session. Any Gopi, sir?
Yeah.
Suresh, sir?
Before closing, I just want to check one thing.
Yes, sir.
Since you have done your AFIH, which
Yes,
is
sir.
concentrating on physical health. Now, psychology is a very common subject which is coming up over there. Do you have any special thing which will train the psychologists into industrial psychology? And one of the recommendations we have given to national disaster management authorities that every industry beyond certain number of workers, there should be industrial psychologist should be placed in that. So does this rule has been?
And that is what has been now taken into consideration in the OSH code, sir. Now they are making a doctor on a visiting basis. So instead of psychologist, they are preferring a doctor itself to come on a visiting basis. Weekly
But mental
once.
health is concerned. But mental health is concerned, we need a psychologist who can understand the problems.
True, yeah. But Anna, role of a psychologist is limited. Maybe that can be referred by a doctor outside.
Yeah.
Need of the
my question is, you are being an MBBS, you're a medical doctor, you have done a special course, you have done a special course on industrial health.
Yes.
Like that, a doctor who is specialized in MBBS with industrial psychology.
No, there is no separate industrial psychology, sir. It is only psychology and psychiatric health. There is no industrial psychology per se. But in industrial hygiene, psychology is a part.
Oh, I see. Okay.
Diploma in industrial hygiene we did separately. In that, psychology is a part.
Okay.
That's a 1 year.
That's one of the recommendations we are given. NDMA we are given one of the recommendations.
The concern, sir, now more of people require sexual health consultations now. Because in industrial aspect, most of their productive life is spent inside the factory walls. They are losing their personal life. So the personal life or the paradigm shift, sexual health boomed up. since I was already a sexual health consultant, they asked me to give a session. And you know, sir, one company, I'll tell you, I cannot name the company. People were like, majority of the people, newly married couples were infertile. It is not, I didn't treat them. It is just a simple counseling session on what to be done, when to be done. இவ்வளவுதான் நாங்க கொடுத்தோம். Eventually, out of that, 60% they are considered they have kids now.
Perfect. Yeah.
We
Yeah.
did,
Yeah.
we,
Yeah.
we did not treat. It is that understanding thing that we have to evoke in the brain.
Correct. Correct. Now that is why
Because
see there are a lot of hidden facts are there in the
yes, yes,
day-to-day
yes,
life which we know not.
yes.
I'll just close it with this small case study which I learned from my mentor
Please.
Deshpande from Calcutta. He was working in the Sundarban area. He's an environmental scientist. He was my UNDP, my senior when we were
Okay.
working in UNDP. And when I visited him, I mentioned this forum earlier, but again, I just want to say it over. I'll just give it as a film industry story, like, screenplay, like 5. Hello?
Yes, sir. Go
There
on,
are
sir.
5 scenes. For example, this is Cherrapunji. For example, Cherrapunji is there. Earlier, it was known for raining round the year. So that was a tourist place. Now Cherrapunji is not getting the right kind of rains. So major livelihood over there is tourism. Okay. Now tourism is slowly diminishing and people are moving to different places. So migration takes place, number one. Okay, from the life migration takes place. Most of the people, they prefer urbanization. Maybe nearest city is Calcutta. Okay, they come to Kolkata and they undertake you take a case of a boy and a girl fell in love and got married. Okay, from Cherrapunji, they are moving to Calcutta. Now, Calcutta is having a lot of infrastructure development is happening, a lot of bridges and mining. So many things are happening. Okay. Now, at this point, earlier the workers were lying and sleeping on the roadside. On the roadside, they were sleeping. So now, after I think 2014 or 15, the government has made a rule that a lot of accidents are happening. So the workers are not supposed to sleep on the roadside. They have to move outside the city and they have to find a place to live. They can come to work, but they cannot stay at the roadside. Now the new couple, now take it as a story. Now they are moving towards Sundarban area with understanding the man will come to city for construction work and the lady will go to Sundarban. It's like our Pichavaram, okay? It's a backwaters. So she'll go for fishing and then they can take care of their livelihood. That's fine. So far, so good. Now, third scenario is a lot of industries are there, especially new industries are coming up. You know, Calcutta environment, how it is. So a lot of industrial waste is coming and getting mixed up with the water in the Sundarban area. And then the water is now contaminated to fish. And it is neither a liquid water nor a solid. It is semi-solid like. So you cannot use a net. You have to keep your hand inside and you can catch the fish, that kind of thing. So the women have to go to the waist level water and they have to go and fish, do the fishing. Now what happens is because they are waist level, the body is inside, their reproductive organs are infected.
Okay.
Now the woman cannot get involved in the family life, and the husbands when they come back, when their sexual life is affected, the husband naturally they find some connections out of the wedlock, where extramarital things. So now the woman was come all the So the woman all the way coming from Cherrapunji, she doesn't have any relative or supporters, anybody. When she is depending only on the husband, but the husband is going out of the wedding contract, so she feels very insecure. This one case I'm talking about. When I visited my professor, and I will state that day I read in 1 week there are 14 suicides happened. So that is where I asked him how this happened. 14 suicides in 1 week. Then he gave the story. Then I constructed and connected all these factors of cultural, social, economical, and climate change related things. How this is having an impact on the social issues which we have been talking about. So every expert will talk from their point of view of industry or a particular thing. So I'm trying to connect all these factors. So factory has got something, social has got something, and livelihood, climate change, everything has to be taken into consideration before coming to an end of industrial hazard conclusion and safety hazards. So we should also link the other factors when we are making a SOP and make it a full-fledged supportive system so that it will be a wide range of activities could be covered, and as Dr. Nailesh was telling, the health could be given as a priority for the community to take. That's what my point is. Thank you.
Thank you. Thank you very much, sir.
Thank you, sir. That's a good insight.
Thank you, Dr. Nailesh. Thank you, Dr. Nailesh.
Thank you, sir.
very much, sir.
Thank you,
very
Gopi,
much
sir.
for taking time out on Sunday morning to be with us.
Sure,
we
sir.
look forward to hosting you again sometime very soon.
Definitely, sir. Thank you all for the great opportunity, and thanks Suresh sir and Gopi sir for the same.
Most welcome. So we are approaching 250th session. Probably we can have an offline meeting. We'll introduce each other. We get introduced and we can take it.
Yes, sir. Sure, sir. Sure, sir.
Can we share all our numbers, contact numbers, so that it will be helpful for us in the future contacts and discussions for further development of our.
Yes, it's there. It's there. It's there in the chat box. Mr. Krishnamurthy is there in the chat box.
Yeah.
I have shared,
Okay.
sir. I have shared.
Please share it, sir, please.
Yes, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you for the
Thank you.
opportunity.